Welcome back to Nourished and Free, the show where we discuss how you can live your life nourished and healthy while also being free from all of the ridiculous nutrition advice out there and the food guilt and the food shame that comes along with it. I'm your host, Michelle Yates, a registered dietitian and disordered eating expert. This also makes me a professional nutrition myth buster. Today's episode is more of a nutrition myth busting episode, and it was inspired by my TikTok around Mustard Girl's diet. If you don't know much about Mustard Girl, go look for the video on my TikTok. I also have it on my YouTube channel, and I'll clue you in. That video in particular was mostly focused on the concerns I have around her promoting disordered eating through her mustard-fueled weight loss journey. The video generated a lot of eyeballs, and with those eyeballs came a lot of comments. And with those comments came a lot of people quick to remind me that she only eats that way because of Lyme disease. I purposely didn't talk about the claim to Lyme disease in my original video because I felt like it was too big of a can of worms to open at the time. But since so many people are convinced that we need to eat a different way just because of Lyme disease, I felt now like I had this obligation to talk more about it. So we're opening the can of worms. Today's episode, we're going to answer the question, does it make sense to change your diet for Lyme disease? And in order to do that, we do need to peel back a few layers and get deep into the scientific process of this, and mostly just get some context around Lyme disease itself. To help me with this, I wanted to bring on an infectious disease doctor. One of my favorite pieces of content out there discussing Lyme disease is a two-part series on the Unbiased Science podcast. This podcast is co-hosted by Dr. Andrea Love, who is actually joining us today, and I'm so excited about it. Dr. Love is an immunologist, a microbiologist, and a specialist in infectious disease immunology, cancer immunology, and autoimmunity. And on top of all that, she represents the American Lyme Disease Foundation. So could there be a better guest for this episode? I mean, honestly, no. And I did not expect her to reply to my request and to say yes. But she did, and I'm so glad she's here today. Dr. Love is going to dig into the scientific method with me today as we seek to answer the question, is altering your diet for Lyme disease necessary? All right. Hello, Dr. Love. I'm so excited to have you here today.
Thanks so much for having me, Michelle. I'm very excited to be talking with you about another realm of misinformation.
There's so much. There's so much. And so I feel like the more experts that can get together and kind of fight the misinformation, the better. So as I was thinking about this episode and how I wanted to structure it with you, I thought it'd be kind of fun if we structured it like the scientific method in a way. And we started off with, like our observations around Lyme disease and what's happening in the media and everything. And then kind of worked through like, all right, let's ask a question here. Let's work through some research. And I personally have observed a lot of talk around people who were instructed to change their diet for Lyme disease. And I have a lot of questions now. So
yes. Your observation is correct. Among many other interventions purported to treat Lyme disease, substantial dietary changes often circulate on social media.
Yes. And it's kind of maddening from my point of view as a registered dietitian. So I thought it'd be fun to combine both of our specialties and seek to answer the overarching question of, is altering your diet for Lyme disease necessary? Is it actually necessary? So to kick that off, I thought it'd be really good to understand Lyme disease, since that's a big part of this question. Diet and Lyme disease are both big things here. So who better than to have you on and to talk through the misinformation we've got around there. So
yeah, absolutely.
Why don't you take a second and actually introduce yourself to the listeners who don't know you and share with us anything that you think would be good to know about why Lyme disease is something that you're particularly passionate about.
Sure. So I'm Dr. Andrea Love. I'm an immunologist and microbiologist. I work full-time in the biotech industry in the field of vaccine development and immunotherapy for both infectious diseases and cancer. I am also the executive director of the American Lyme Disease Foundation, which is a nonprofit that is specifically geared towards dispelling misinformation about Lyme disease. And the only people involved in our organization are experts in Lyme, whether they are healthcare providers or scientists like myself. So no patient advocates or people without a vested interest or with a vested interest in Lyme disease or financial interest and so on. I'm also the founder and co-host of Unbiased Science, which is a science communication hub that addresses misinformation and misconceptions about all sorts of science and health topics. And I have been immersed in the Lyme disease arena since I was a child. I grew up in a town adjacent to Lyme, Connecticut. So Lyme disease is called such because the first group of cases were identified in Lyme, Connecticut. And I also did my doctoral dissertation research in the immunology of Lyme disease. So I've really been in the thick of it for many, many years.
Yeah. I mean, clearly, you grew up next to the town that it was
Yeah.
originated.
Yeah.
That's pretty cool.
The epicenter of Lyme I've lived in pretty much my entire life. So, and I've
Yeah.
not ever personally gotten Lyme disease.
Oh, I'm sorry. Then we can't
No,
follow
you're right.
anything you're
You're right.
saying then.
If you don't have personal experience, people who promote falsehoods, they automatically try and discredit you, which is an interesting phenomenon.
Yeah, you're totally unqualified now at this point.
Yeah. Yeah.
Oh no, but now that we know you're an actual badass, let's do some research on Lyme. So give us a quick overview of
Yeah.
how Lyme develops and who is actually at risk.
Sure. So Lyme disease, and it's kind of troubling because I feel like it was named to kind of characterize this disease state. But as a
Mm,
result, it's kind of been co-opted to insinuate that it's this persistent illness. So Lyme
mm,
disease is a bacterial infection caused by a bacteria called Borrelia burgdorferi, which is a spirochetal bacteria, which means it's shaped like a corkscrew and it moves in like a corkscrew fashion. These bacteria are only transmitted in the United States by two species of ticks: the black-legged tick, which lives mostly on the eastern part of the US, predominantly clustered in the Northeast and the Midwest, although geographic range is expanding with climate change, and the western black-legged tick, which lives primarily along the California coastline.
okay.
It is not transmitted person to person. It is not inherited. It is not transmitted by other biting insects like mosquitoes or fleas. It is not transmitted by other species of ticks. It is also not transmitted by blood transfusions, by sexual contact, or I'm trying to think of any other claims that
Diet,
I've heard.
perhaps.
Yes, it is not transmitted by diet, certainly. So it's caused by a bacteria. And the good thing about bacterial infections is that we have a lot of medications that can treat bacterial infections.
Mm,
These are called antibiotics, and these are medications that essentially interfere with how a bacteria survives and reproduces, and as a result kills the bacteria and eliminates the infection. So it's a similar principle to taking antibiotics for strep throat. Strep throat
mm,
is a bacterial infection caused by a different species of bacteria in the streptococcus family, or something like a staph infection on your skin, right? Turf burn or something like that. You might take antibiotics for something like that. So the same
mm.
principle holds true for Lyme disease. You take antibiotics. Depending on the symptoms that you present with, there's a few different kind of clinical presentations. You would take antibiotics anywhere from between 10 and 28 days. And
Mm.
after that, the bacteria are cleared from your system and you no longer have Lyme disease.
Okay. So I listened to your two-part series on this on Unbiased Science podcast, which if anybody hasn't checked it out, it's fantastic.
Thank you.
And I remember you saying something about how there's only about, was it like 10 to 20% of ticks even carry Lyme? Is that right?
Yeah, so that is 10 to 20% of ticks within those two species. So
Oh,
there's actually close to 900 species of ticks in the world. In
yeah.
the US, there are about 90 species, and a very small proportion of those species are actually concerned for humans. So there's this misconception that all ticks bite humans and all ticks
Mm.
carry all of these different pathogens, and all of these pathogens are transmitted to humans. And it's way more complicated than that, because ticks, even species to species, have different chemicals and molecules in their bodies. They have a very different physiology. Their body temperature is much lower compared to mammals and humans, of course. And in order for a pathogen, and in this case, we would talk about the Lyme bacteria, to survive there and also survive the trip from the tick into the human, and then survive in the human and then grow to the point where it will cause illness. There's so many different checkpoints that
Mm-hmm.
bacteria has to overcome. And there's a lot of very complicated processes. It's changing how it metabolizes carbohydrates because
Mm-hmm.
the sugar sources in a tick are different than the sugar sources in a human. The
Right.
oxygen levels are different. And so, just because you got bitten by a tick, even if that tick had this bacteria, there's no guarantee that you're going to be successfully infected with it. The data demonstrate that only about 1 to 5% of tick bites of these species actually result in a Lyme infection. So the risk
Wow.
of Lyme disease, it's growing because populations of ticks are increasing, but the risk is actually quite low.
Yeah.
You don't have to be terrified every time you go outside and you encounter a tick, even if it is the black-legged tick. Because on top of that, the tick has to actually feed on you for a minimum period of time before the bacteria can get into your body. And the reason for this is because within a tick, and I wish I had my little stuffed animal tick near me. But the tick has this region of the body called the midgut, and you could kind of envision that like the stomach of a human.
Mm-hmm.
And when the tick hasn't taken in a blood meal, meaning it hasn't fed on an animal, the bacteria are kind of just hanging out in the midgut, kind of dormant, like they're not, because they don't have a sugar source from blood. They're just kind of hibernating, I suppose
Yeah.
you could say. And in order for them to stop hibernating and start reproducing, a tick has to get onto your body, climb to a place where it likes, usually a, armpit or behind the ear or a place like that. And that can take up to 2 hours after a tick has climbed onto you to find a suitable place.
Wow.
Then it has to bite you, and it has a mouth part called a hypostome that it inserts it's like a barbed needle, and then it secretes chemicals to kind of cement itself in, and then it starts taking up blood. And when it takes up the blood, the bacteria that are in that midgut compartment, they get oxygen and they get sugar and they get all sorts of nutrients from that blood, and they start to wake up and they start to reproduce.
Hmm.
So they don't actually like swim to the mouth in order to get into the mouth parts and get into the human. They actually wait in the midgut until they've reproduced so much that they're too crowded to fit in there, and they physically get forced into the mouth. And
Hmm.
that process takes 48 hours. So
Wow.
you realistically can't get infected, even if that tick is infected, unless the tick has been feeding on you for 48 hours. Now we say 36 hours to be a little bit more conservative.
Yeah.
But actually in my previous lab, my collaborators, my colleagues actually did pull off experiments to look at the time course, the kinetics. And, it really is, the risk is almost zero until you hit that
Yeah.
48-hour time point.
And most people I know, if they're in, I mean, of course, this comes down to like your knowledge of even knowing that ticks are present in that area in the first place. But when people do know, hey, there's ticks in this area, make sure you check yourself for tick. Like, I feel like I've heard that so many times when
Oh
someone,
yeah.
because I live in the Midwest, and so it's like common practice to check yourself for ticks.
Oh yeah.
So it's like very rare that you're going to have a tick on you for 48 hours or even
Yeah,
36 hours.
absolutely. I mean, so right now CDC estimates that there's between 400,000 and 500,000 cases of Lyme every year. That's probably an overestimate because those estimates are based on the number of antibiotic prescriptions written.
Ah,
And we know that antibiotics are overprescribed because people go in and are like, I got bitten by a tick, I have Lyme disease, and often clinicians will prescribe it to kind of pacify the patient. But even if you say, oh, it's 500,000 cases per year, there's over 330 million people in the country. So again,
yeah.
the proportion of people that are getting infected with Borrelia burgdorferi is very, very low. And again, there's multiple layers. You have to live in an area where these ticks are prevalent. You have to be in environments where you'll encounter a tick. If you're in an urban apartment and you're not going out in the woods, like, you're very unlikely to encounter ticks on a regular basis. And then you have layers, right? So you can prevent tick bites using effective repellents like DEET and picaridin. Then you can use insecticides, which will kill ticks on contact on your clothes clothing like permethrin. Then,
Mhm.
of course, you always want to do tick checks, and showering after you return from indoors is always a good practice within a couple of hours, because that will catch any ticks that maybe are crawling on you but haven't bitten.
Oh, okay.
And then, of course, if you find a tick, you remove it mechanically with tweezers promptly. And, you do that within 48 hours, and, pretty much you've eliminated that risk of Lyme disease.
Okay. Awesome. And I just did the math on this really quick because I was like 500,000 to, you said 330
330
million
million
population,
Americans.
right?
Yep.
Is a 0.001%
Yeah.
chance.
Yeah. Yeah, it's very low. And again, you can get infected with the bacteria multiple times. It's like getting strep throat every year. There are different strains of Borrelia burgdorferi out there. So it's not like you get it and it's a one and done. But again, it's very, very densely concentrated in the Northeast and the Midwest. It's 15 states in the US that account for 95% of Lyme disease cases.
Okay.
So, places in like Texas and Arizona, you're not going to see a lot of Lyme disease. You're going to see it in New England, the Mid-Atlantic, the Midwest states, because that's the geography, the climate that the tick species that transmit the bacteria, those black-legged ticks, which are sometimes called deer ticks,
Hmm.
and that's where their preferred food lives. And the preferred food of the early life cycle of the tick is the white-footed mice, and adult ticks like the white-tailed deer. They don't really prefer humans. They don't really prefer your dogs. They'll bite us if they encounter us, but they're not actively seeking out people to bite.
That is so fascinating. Like the amount of just mind blown that this is. Like there's such a small amount of people
Yeah.
who, and it's
Yeah.
not to say that it doesn't exist. It clearly
Absolutely.
does.
It does exist. And depending on the strain of bacteria, it can cause, debilitating symptoms. And again, that's why we have antibiotics that are very
Sure.
effective at treating infection if infection occurs.
So what are some of those symptoms that we see with Lyme disease?
Yeah, so the challenge is the symptoms can be quite generic. The stereotypical symptom that occurs in between 60 and 80% of cases is this bullseye rash or erythema migrans. The challenge is that some people are not very observant, and so they might have the bullseye rash or the EM, but they might not necessarily know it. Or if they have darker skin, it might not be as
Mm.
obvious, or they're expecting it to be a very discreet bullseye and it's more of like a reddish splotch. On top
Yeah.
of that, there are other things that can cause rashes. There are other insect bites or arthropod bites, like spider bites, that can kind of look like that. For me,
Mhm.
for example, I have a very pronounced histamine response to mosquito bites, and I get these really giant red welts when I get bitten by mosquitoes. And
Mm.
there's other dermatological conditions that can look like these sorts of rashes. But again, this rash is present in 60 to 80% of cases, and that rash appears typically starting at around 7 days after the tick bite, because that
Oh,
rash is a
okay.
sign of the immune response. Basically,
Hmm.
those bacteria are in the skin, and I'll use my arm as an example. The tick bit here, the bacteria are in the skin. The immune cells are like, hey, that doesn't belong here. And they're called
Yeah.
to alarm there, and they create these chemicals that create inflammation in the skin, and that's where you get that redness. And the rash spreads out over time because it's this wave of immune cells that are coming into the skin. So
Mm.
that's symptom number one. The other symptoms are very non-specific, things like fatigue, low-grade fever, headache, muscle aches, joint aches. Sometimes people can get swollen lymph nodes, which is called lymphadenopathy, and typically that's going to be kind of the bulk of it. The vast majority of infections with Borrelia burgdorferi will not spread from the tick bite location in the skin, even if you did not treat with antibiotics.
Mm.
There are certain strains of the bacteria that are able to kind of hide out or evade the immune response that would clear the bacteria or eliminate the bacteria. So the immune cells are producing chemicals that can kill bacteria and things like that. They have these professional eaters in the immune system that eat bacteria and digest them. But in some instances, I'm saying 10% or fewer of infections, the bacteria can hitch a ride within our bloodstream or lymphatic vessels and spread to other body sites. And in
Okay.
those instances, they will typically go to the large joints, most often the knees, the peripheral nerves, particularly like in the neck and in the face, and then sometimes other parts of the central nervous system. Very rarely, the bacteria can get into the heart muscle. So,
Hmm.
in those instances, we call that disseminated Lyme disease, meaning that the bacteria have moved from localized at the tick bite to other sites in the body. So, if
Okay.
you had disseminated Lyme disease in the joints, that would present as Lyme arthritis. And that
Hmm.
is typically visible joint swelling and it's asymmetrical. So, typically, you're going to get swelling visibly on one side of the body and not the other. And sometimes it moves around. So, like one day your right knee might be swollen, the next day your left knee might be swollen.
Interesting.
Um, when it presents in like the face, you can get this Bell's palsy or this facial drooping. Basically, what's
Hmm.
happened is you have an inflammation in a nerve in the face, and that leads to the nerve not properly innervating the muscle of the face, and so you have this drooping sensation, and it's involuntary. Occasionally, Lyme can also lead to like a meningitis, meaning an inflammation of the layering of the central nervous system. So that can include stiffness in the neck and neck pain and additional like higher grade fever. And that's something that you would get an IV antibiotic very quickly and that would eliminate. And then in very, very rare instances, like I said, it can lead to what we call Lyme carditis, which is an inflammation of the heart muscle. We probably heard a lot about this with COVID.
Yeah.
A lot of infections can cause inflammation of the heart muscle. In the case of Lyme, it's called Lyme carditis. So this would be like a fluttering or an irregular heartbeat sensation.
Mm.
And again, this happens in only about 1% of infections.
Yeah. Scary nonetheless, even just to know it's
Absolutely.
possible.
Absolutely. So it's always important to be aware of these more serious symptoms. But again, these are treatable with antibiotics.
Yeah. You said that disseminated Lyme is not in all cases of Lyme. It's
Correct. Correct.
pretty rare
Yeah,
considering,
usually
right?
it's about 10% of infections that
Okay.
could have the potential to spread to other body sites, and that's assuming that you didn't get treated promptly. But in reality, even if you didn't realize you got bitten by a tick and you got infected, the majority of the time your immune system does a really good job at getting rid of infections. That's what
Hmm.
it does, right? That's its profession. So even in those instances where you might have gotten infected, most of the time your body would clear it even without intervention.
Okay. So for those who have this Lyme arthritis, like you said, that's kind of where I can see maybe some rationale for people jumping to some dietary intervention
Sure.
because
Yeah.
they're thinking like my joints hurt, I'm inflamed, I need to go on an anti-inflammatory diet. Now, anti-inflammatory diet, that's a whole other podcast episode in terms of misinformation, which I already have if anybody wants to listen to it.
We have one too.
Yeah. So I'll link that in the show notes. I'll also link yours in the show notes. That's good to know. We'll be right back after this quick break. If you find yourself sneaking into the kitchen or pantry to binge or emotionally overeat on the foods that you swore you would never eat again, then keep listening. Did you know that your relationship with food actually plays a huge part in why you eat the way that you eat? And just like any relationship, if you don't take care of it, then things typically don't go well. If you've tried every diet under the sun, but you just feel even more lost than before and wishing that you could just eat like a normal person, visit yatesnutrition.com to check out my free mini course on how to conquer binge eating once and for all, or to check out the many other resources I have that can help you with healing your relationship with food today. Let's get back to the show. So there's a lot of misinformation around that, but even if we are talking a correct, accurate anti-inflammatory diet, I think what I'm hearing from you is we can still reduce the inflammation just through antibiotics, right?
Yeah, absolutely. So, this inflammation in the joint, the arthritis. So arthritis is just a word that means inflammation of the joint, right? That word itis just means inflammation. And unfortunately, and I'm sure you know, Michelle, that the word inflammation has really gotten co-opted to kind of
It's a buzzword.
yeah, it's a buzzword. It diagnoses everything. It's
Yeah.
you can cure it all through diet, and in reality you need inflammation to survive. And inflammation is a natural process that's constantly occurring in your body, and it's constantly balanced by anti-inflammatory processes. And if you try to stop it or halt it or delay it, you could mess up A lot of things. Technically, every single time you exercise or digest anything, you're creating
You're inflaming.
inflammation
Yeah.
because
Yeah.
you're breaking things down and when you break things down, you release energy, and technically that, it creates inflammation. But yeah, absolutely. So the arthritis that is caused as a result of disseminated Lyme disease is a result of the immune response in the joint. And when you consume food, even if someone wants to call them anti-inflammatory, and we know that that's really a misnomer, because we know that there are foods that are more nutritious, more nutrient dense, but nothing that you're eating is actually reducing inflammation or promoting inflammation. It's all about the proportions of food,
Mhm.
the density of various nutrients, macromolecules, and so on. But even if that were the case, what you're digesting is not getting deposited into your joint. It's the same logic that people use when they talk about, collagen supplements to improve joint function. It's not getting shuttled to your joint tissue to help alleviate this temporary swelling as a result of a bacterial infection. What is going to help is taking antibiotics. Now,
Mhm.
in some cases, some of these symptoms of disseminated Lyme disease can last after the antibiotics have been concluded. And it doesn't mean that there's still bacteria hanging around, or you have this latent infection, or it's dormant, or things like that. It's just a consequence of your immune system. It needs time to reset to baseline. And
Mm.
in most people, that happens pretty quickly. But in a small proportion of people who have disseminated Lyme disease, it's less than 10%. They may have these persistent symptoms that last for a period of months after treatment. And this has been called chronic Lyme disease. It's not a chronic infection. You don't want to be taking these long-term treatments because they're not effective, not even antibiotics long-term, but it's post-infection sequelae, right? It's post-treatment symptoms that are not an indication that you're still infected.
Mhm. And not an indication that you're still needing intervention.
Correct, exactly.
Yeah.
And there's actually been a lot of clinical trials that have looked at extended duration of antibiotic treatment, and there's no benefit, and there can be harm to taking antibiotics long term, because some of them
Mhm.
can kill off the good bacteria that you need for digestion and metabolism and bodily functions.
Right, right, which is damaging in its own way.
Exactly, exactly.
So I can imagine there's a lot of listeners that may be confused because we're talking about how Lyme is basically totally curable by antibiotic.
Yes.
And yet there are a lot of providers, doctors, etc., who are saying it isn't. And we need these long-term treatments, long-term interventions of all kinds of nature. So fill us in on why there's that tension there and that confusion, and why there might be some controversies around the Lyme specialists and the alternative therapies they prescribe.
It is extraordinarily controversial, and I still don't quite understand why Lyme disease really got the brunt of
Yeah.
this, because in the world of infectious diseases, yes, it can be not pleasant, but it's not fatal. It doesn't lead to disfigurement, disability. Like, there are a lot of other nastier things out there. So, but this all kind of started back in the 80s and the 90s, when Lyme was kind of first being understood. And it started because, a parent, her kid wasn't diagnosed initially because we were still learning about Lyme disease. And she became kind of an advocate, and that led to a lot of really important findings on Lyme disease. But then that, like, advocacy kind of got co-opted by the new generation of Lyme advocates, which basically
Mhm.
now discredit actual experts, including the Infectious Disease Society of America, who are the experts on infectious diseases. And they basically say that, well, they're all wrong because I have these symptoms, and, my alternative health practitioner told me that it's chronic Lyme. So what happened in the past couple of decades is that these groups that are patient advocacy groups, not scientific organizations, have essentially come out, and they have a faction of clinicians, some of which have medical degrees, many of which are chiropractors or naturopaths, or people who are very unqualified. But many of the MDs are not infectious disease specialists. So they might have started as a psychiatrist or something, but they have an MD at the end of their name. And they created this coalition alongside private labs that create fake tests to diagnose Lyme disease.
Big yikes.
And yeah, it's very complicated. And they all make a ton of money when these advocacy organizations send referrals to them. So these clinicians call themselves Lyme literate specialists or Lyme literate physicians. So if you hear that word, it's
just
usually
like,
a red
do you
flag.
mean nobody else is literate? And
That's
like, what
exactly
in the
what that's
world?
exactly what they insinuate. They say that true infectious disease specialists, these are ones who did clinical fellowships in infectious disease, don't know what they're talking about. They're hiding the truth. And you have to go to a Lyme literate specialist. And these Lyme literate specialists basically prescribe these fake tests for Lyme disease that are not validated or standardized, and actually just report false information. And they use bodily fluids that you would never actually be able to use to diagnose an infection like this, like urine. Then they diagnose people with Lyme disease who have no epidemiological evidence that they were infected, meaning they weren't in nature. They don't have evidence that they were in a geography where these ticks live. They don't have a recollection of being bitten by a tick, and so on and so forth. But maybe they feel tired and they feel a little depressed and so on. So they get diagnosed with Lyme disease by these Lyme literate specialists. And then these Lyme literate specialists put them on all of these out-of-pocket treatments, none of which have any evidence to support them, including everything from like colloidal silver and other chelation therapies to all sorts of supplements, long-term IV antibiotics, which is very, very dangerous. All sorts of other things like hormone therapy and ozone and urine ingestion and enemas and all sorts of things that not only are completely disproven, but can be very, very dangerous. So it's this very concerted, organized and tactical strategy that's really spearheaded by many high profile organizations to claim to be the experts in Lyme. And they talk about, being the voice of the patient, which makes people feel empowered. And they
I'm
also
sure they want to be listened to and heard.
exactly,
And that,
and they often claim that, well, you don't have multiple sclerosis, you have Lyme, when in reality the converse is very possibly true. Lyme in this sphere is used as this catch-all diagnosis. And another harm is that these people are getting these, unproven and harmful treatments that are not going to cure Lyme, even if they had Lyme. But now you're ignoring potentially other real medical issues that could be addressed, like autoimmune disorders, like depression, like, rheumatoid arthritis, and so on and so forth. So it's very multifactorial, and it's compounded by the fact that these organizations get a lot of money from celebrities, high profile celebrities like the Hadid family, who, supposedly the whole family has had Lyme disease for decades.
The whole thing,
And
it's genetic.
her
Now.
mother, the mother, the daughter, the son, they all have Lyme disease apparently. But they're high profile. They have millions and millions and millions of followers. The media catches on their every word. And so it legitimizes this when there's zero evidence to support it. And it's really, it's very frustrating and disheartening. And, when we try to address a lot of these misconceptions and be like, hey, like, you probably haven't had a bacterial infection for years, because if you did, like, you would likely be hospitalized and, and seriously ill. Maybe we're not addressing another medical issue for why you feel, the way you feel, why you have lethargy, why you have fatigue, why you have body aches. Maybe there's something else that needs to be explored, like depression.
And I think that's pointing to an interesting, you said they call themselves patient advocates. And when we think about that, if we're ignoring what the real causes are, how is that advocating for the patient at all?
Absolutely. And, and I think it's really important to remember that, the medical industry is imperfect.
Right.
I mean, the healthcare infrastructure is imperfect, and that trickles down to impacting how physicians, MDs, are able to treat patients.
Yeah.
But it's very often like healthcare infrastructure is often conflated with science and medicine. And I think people forget that these organizations, these advocacy organizations, or these people promoting supplements or unfounded treatments, like these things are not covered by insurance because there's no evidence to support them. So you're paying
Yeah.
tons of money. I mean, these companies are raking in millions of dollars. Not only are they not doing anything to help people, but they're actively harming people and in doing
Yeah.
so.
Which is scary.
Yeah.
It's very scary. And I know I brought up like the mustard girl TikTok with you before we started recording. I have seen so many people comment either on her videos or even on one of my videos that was in response to it about how they have Lyme and they've been in treatment for years and years. And I just like my heart breaks because I wonder what harm is being done and what help they actually need that they're not getting.
Yeah, absolutely. And it's really hard because you try to walk this balance about like being assertive with the information that you're sharing to try and address these, because the Lyme misinformation has been going on for decades. It's really
Mhm.
accelerated with social media and
Sure.
celebrities platforming it more and more, but it's not something new. It's decades and decades old. And the evidence changed. If we had evidence that antibiotics weren't clearing infections, and that would be updated in the Infectious Disease Society of America's clinical guidance. But
Mhm.
we've done decades of research, and the story hasn't changed. But these individuals who kind of propagate this, they basically try to erode trust in science, and are like, well, don't believe these people who say they actually are doing research in Lyme disease, because they're just in on the conspiracy, they're just hiding it. And it's like, why would we subject ourselves to the abuse and the vitriol of trying to address this? Because like these,
Yeah.
no,
Good
I'm not,
point.
I'm being completely serious. Like these
It's a good point.
organizations, they have sued the American Lyme Disease Foundation and my board members
Mm,
routinely because we
man.
we are not profit. We don't make a profit. Like we have enough money in our bank account to keep the website going. We do this volunteer, but these organizations, like they fundraise a ton. They make tons of money. So they have legal resources. So why would we subject ourselves to legal challenges?
Yeah.
I mean, doxing, violent, hate mail. I don't want to subject myself to that, but I feel an obligation because this is doing harm to people. They're not getting treated for real medical issues. I want them to get treated for real medical issues. And I also want them to stop believing or being afraid to go outside, because
Yeah.
it's not that scary to go outside. There's a lot of things you can do to, like I've said, I've never gotten Lyme disease. I've been bitten by probably 100 ticks in my life. I used to collect ticks for experiments, literally intentionally dragging sheets through tall grass to grab ticks and use them for experiments, which means they're also climbing on my body. And because of all of those things that you can do to prevent Lyme disease, I have never gotten Lyme disease, which really underscores how difficult it really is to kind of get Lyme disease.
Yeah.
And the likelihood that the 1 to 5% of tick bites that result in Lyme disease are so heavily concentrated among these celebrities is very, very suspicious.
Very suspicious. Yes. And I think you made such a fantastic point, and I was laughing because I just am thinking of all of the trolls. I'm sure you guys get this on social media that are like, "Oh, you guys are just a part of," well, for me, it's like I'm a part of big food, or I'm a part of, you guys
Yes.
probably get big pharma, whatever it is. And you just kind of have to laugh at one point because it's like, do you really think that we
Yeah, like what about big
want
supplement?
to?
What about big
Yeah.
naturopathy?
Right.
What about big wellness industry? I mean, look at
Right.
Gwyneth Paltrow. She makes billions of
Oh man.
dollars
Don't even get
hawking.
me started.
But I mean, and they're like, and these, on top of it, these treatments for chronic Lyme, you're taking them for months, right? So every month it's
Mm,
thousands more dollars and thousands more dollars and thousands more dollars. And there've been Lyme literate clinicians that have had their licenses revoked. They've been shown to do real harm. This
mm,
one, there's very notorious ones who have led to the deaths of people because of these harmful treatments. Why are we not talking about those? Why are we? It's just a very interesting case of cognitive dissonance. And, I hate that there are these people who are like, these symptoms resonate with me. I must have chronic Lyme. And I think that underscores issues with social media to begin with and self-diagnosis. But with Lyme in particular, it's legitimized because you can go to CVS and buy a urine test for Lyme, which is completely fraudulent. And it will give you a false positive. And then you're like, well, I have Lyme. And in reality, you don't. And now you're neglecting treatment for something else that you very likely may be suffering with.
Yeah. Yeah. But we just love hearing from people how wrong we are, which is why we decide to talk about it. It's so much fun for us.
Yes.
Yeah. Yeah. You bring amazing points into this conversation. And so if we're kind of circling back to that overarching question of, is altering your diet really necessary for Lyme disease? So far, what we know is, okay, the chances of having Lyme are so slim because only, as you say, is 1 to 5% of ticks
1 to 5% of
the
tick
two.
bites of the species actually result in infection.
Okay, there we
And
go.
if you collected ticks all over the place and surveilled them for, the presence of that particular bacteria, depending on where you live, it's between 10 to 30% of ticks even would have the bacteria in them. Then, of course, they have to bite you and feed on you for a certain period of time. And then your immune system, has to not notice it for long enough for the bacteria to survive the trip from the tick into your body. And so yeah, many layers. The likelihood is very low. Yeah.
So low. And another way to put that is that only about 500,000 people are supposed to have this per year. And in the span, or in the context of our entire country, that's about 0.001%. And even that is overestimated because we think there's a lot of antibiotics that aren't needing to be prescribed due to false positives. So getting Lyme in the first place, contracting it, suffering from it, having symptoms even of it is very rare. Mm-hmm. And having these symptoms of inflammation is even rare.
Yes. The Lyme arthritis, again, I would say that's, of the disseminated presentations, that's the most common, more common than like a facial drooping situation. Okay. or a heart complication. And, that sounds scary for sure. But even that, the Lyme arthritis really only occurs in about 10% of successful infections when they've been left untreated. So again, more layers there.
Yeah. Okay. All very good to know. We also know that it's curable with an antibiotic, a quick round of antibiotics.
Yeah. And these antibiotics there's multiple options. So if you do have allergies to certain antibiotics, there's other ones you can take. They're very effective at killing these bacteria, the Borrelia burgdorferi, and they are very well tolerated by people. So, you don't need to take any of the other long-term, unproven, disproven, potentially harmful. You don't need to remove your dental amalgam. You don't need to take colloidal silver. You don't need to change your diet. Changing your diet is not going to help you with your symptoms of Lyme disease, even if you have an active infection, just like it really isn't going to help for if you have strep throat or another type of bacterial infection.
Yeah. So good. So there we have it. I mean, when we're looking at the dietary involvement with Lyme disease, there's none, right? There's no factor of diet with the origination of Lyme disease, no influence of diet on the symptoms of Lyme disease. Nope. It's all curable by antibiotic. So we've got our answer, I think, to our question here. Is it necessary to alter your diet for Lyme disease? Absolutely not. And
absolutely not.
The capper to this, or the cherry on top, is that I tried to find if there was any research at all on, and you already know the answer to this, I'm sure, on changing your dietary interventions for Lyme disease. And there was a grand total of 0 studies on it.
Yes.
So
yeah,
even if it was possible, there's no research to show us that it's necessary. We only have the hypotheses and it's reasonable to think that maybe changing your diet to be a little more anti-inflammatory, which is a whole topic on its own, would potentially help with that's all we have is just the best guesses of people who are quote unquote Lyme literate and are known for providing other unnecessary
Yeah.
interventions. So,
And usually they're going to be recommending some named dietary protocol that they're selling
oh yeah,
alongside
yeah.
some dietary supplements that they're also selling. And we've talked at length about the lack of regulation and efficacy data on supplements. But again, they're very often promoting this in order to make money off of misleading people. And my logic is, I mean, everything in moderation. You want a balanced and diverse diet, no matter whether you're sick or healthy. Lots of
Mm,
fiber, lots of produce. Those things are very nutrient dense. They have all the macromolecules you need. You want your immune system to be functioning well, and those are the things that
yeah,
get your immune system functioning well or ensure they're functioning.
right.
But it's not anything that's going to like boost it or improve it or make it more targeted to addressing Lyme disease. And for me personally, like if I'm feeling crummy because I'm sick, if you want a bowl of ice cream because you feel crummy and that's comforting to you, go for it. It's not going to be
Mhm.
hurting your Lyme disease as long as you're taking your antibiotics.
Yeah, I love that. That's like the takeaway moment of this whole
Like if
episode.
I have a fever and my joints ache and I feel fatigued, I mean, whether it's Lyme or the flu or COVID, like if I want a big bowl of ice cream because that's going to make my psyche feel better, I'm having a big bowl of
It's
ice cream.
important mind-body connection, man. There's
Absolutely.
something there. Well,
Hmm.
any other thoughts that you want to share on this topic?
I think, I get it. I get that it's frustrating when you aren't feeling great and the world of social media is rife with misinformation and filled with people claiming to be experts. But just like with all nutrition misinformation topics, before you buy into something, just take a beat, think about whether it even makes sense in the first place. Try to seek out credible sources to cross reference that information. And by credible, I don't mean like another TikToker. I mean like a medical or scientific authority, organization, etc. Simply doing a search online is not doing your research. Even if you find something on PubMed, that's just a repository. It doesn't mean that the papers there are all good. So you
Preach that.
can't, yeah, it's very, I get it. It's very difficult to discern fact from fiction. But a good rule of thumb is everyone has expertise in different things, and a celebrity is probably not an expert in infectious diseases or nutrition sciences. So I would recommend seeking out credible experts in whatever topic you happen to want information on.
I love that. So here we have it. Is altering your diet for Lyme disease necessary? No. Why? Because number one, context is important. One may think they have Lyme just from a false diagnosis, a
Yep.
false positive. So if you don't even have Lyme to begin with, changing your diet is really unnecessary if that even made sense, which it doesn't, because the infection of Lyme is completely unrelated to diet. It's contracted from a tick
Tick
to
bite.
begin with.
Yeah.
Lyme, as long as it's properly diagnosed, can be treated by antibiotics, thereby ridding the symptoms completely at some
Yep.
point, even though some people might have them for a little bit longer.
Yep.
And there's no studies proving that a dietary pattern for Lyme makes any sense, including an anti inflammatory diet, which
Yes.
is its own thing. So
Yes.
I'm going to say that every time.
No, I love it. I love it. Such a good concise summary of it all. And I know you talk about this at length, but all of these rigid dietary things, they just, are psychologically and potentially physically harmful. They often
Mm,
promote disordered eating. They can make you malnourished. Again, everything in moderation. You need certain nutrients to be healthy and fuel your immune system, but again, your diet is not going to be curing or eliminating infection.
yeah, so good. So good. Thank you so much for your time, Dr. Love. This was
Thanks for
awesome.
having me. This was so fun. I mean, the world of food science and nutrition science is a messy and complex one, and so we need more people like you getting out there and dispelling the misconceptions.
Oh, right back at you. Anybody that is interested in just misinformation, combating the misinformation, period, definitely look up unbiased science. And if you like podcasts, which I'm guessing you do if you're listening to this one, check out their podcast. It's incredible, and you cover a lot of hot topics. And yeah, is there anything else that you think the listeners could be pointed to that would be helpful for them?
Yeah. So, I mean, if you're interested in Lyme disease specifically, you can check out the American Lyme Disease Foundation website. It's www.aldf.com. And then, of course, Unbiased Science, we do have a searchable database on our website. You can find that through our social media handle, which is at Unbiased SciPod.
Highly recommend the follow too. You guys had a lot of really good infographics about Lyme disease.
Yes, I'm working on some new ones, and I actually just started an Instagram for ALDF too, although it's a lot managing that many social media pages. So
yeah, that's a lot. I have one, and I even hire out a bit of it. So
yeah. someday.
Yeah. Well, thank you so much for your time, and this was fantastic. I appreciate you.
Thanks so much, Michelle. Really enjoyed our chat.